This video is one of a three-part series looking at the most common serious diseases in pet ferrets: lymphoma, adrenal disease, and insulinoma. In this video, we'll focus on insulinoma, but links to the other two serious illnesses are found in the description below and in links at the end of the video. As always, our videos aim to expand your understanding of ferret health, behaviour and husbandry, relying on facts and scientific study rather than personal conjecture. Therefore, as always, there will be a list of scientific publications and studies in the description below, which will support the facts and statements I make in this video. So let's jump right in. The pancreas is a relatively large gland which sits surrounded by the intestines within the abdomen of the ferret. The pancreas has two main roles: firstly, to help with digestion, and secondly, to regulate blood sugar. It's the second of these two roles which are of interest for insulinoma. The pancreas regulates blood sugar levels by increasing or reducing the production of insulin. Insulin is the key which allows cells within the body to absorb glucose. If there's too much glucose in the blood, the pancreas will create more of these insulin keys, enabling the cells to absorb more glucose out of the blood. If glucose levels are insufficient within the blood, then the pancreas will reduce insulin production, enabling the blood glucose levels to be restored. Insulinoma is specifically a tumour within the insulin-producing cells of the pancreas. In healthy ferrets, the ratio between the blood insulin and glucose levels will remain constant because of the function of the pancreas. But when tumour cells are present in the pancreas, they release insulin autonomously, regardless of the level of blood glucose. Therefore, insulinoma causes excess insulin production, which in turn can cause dangerously low levels of glucose in the blood, otherwise known as hypoglycemia. Insulinoma is the most commonly diagnosed cancer or tumour within ferrets, with a reported prevalence of around 20 to 40% of all reported tumours, depending on which study you read. Not too far behind is adrenal disease and lymphoma, which are covered in the other two videos of this series. Whilst there are some studies which have compared the relative likelihood of insulinoma compared to other cancers or tumours, there doesn't yet seem to be a reliable study which identifies the likelihood of insulinoma arising within a ferret's lifetime. Although this is a difficult statistic to identify accurately due to the inherent pitfalls in obtaining full and true information. Such pitfalls include no diagnosis given because the pet owners didn't go to the vets, a misdiagnosis, other diseases which mask the true underlying condition, or selection bias due to the group chosen for the study. Therefore, any data which does offer a population-wide likelihood of a ferret obtaining a certain disease throughout its lifetime should be taken with a certain pinch of salt. Finally, whilst in humans females are more predisposed to obtaining insulinoma, this does not seem to be the case for ferrets, with no identifiable difference between males or females. As ferrets evolved on a natural carnivorous diet, a modern-day diet which is higher in carbohydrates has been proposed as a contributing factor to insulinoma in ferrets. The argument here being that as carbohydrates digest directly into glucose, there will be a higher level of glucose in the blood than would otherwise exist on a carnivorous diet. This excess blood glucose stimulates much higher insulin production than would otherwise be, and this additional strain on the insulin-producing cells of the pancreas causes them to damage and mutate, ultimately leading to insulinomas. Whilst this all sounds logical, publications do acknowledge that there are currently no studies which conclusively support these suggestions. There has been some medical discussion on the comparison between cats and ferrets when it comes to hormone-producing gland diseases, the question being that if diets high in carbohydrates do cause insulinoma, then why is the incidence rate of insulinoma in cats quite rare when they are fed very similar diets to ferrets? One suggestion is that high carbohydrate diets do still cause a disease of the pancreas. It's just that the disease for cats is one of exhaustion of the insulin-producing cells, resulting in diabetes rather than insulinoma. In humans, there are certain genes which have been identified as having tumour-inhibiting actions. These genes do not exist in ferrets, and therefore ferrets are just more predisposed as a species to developing tumours and cancers. In terms of differentiating the occurrence of tumours between different ferret populations, it is theorised that predisposition to insulinoma has hereditary characteristics. This means that ferrets inherit an increased susceptibility to insulinoma from their parents. The lower genetic diversity in the North American ferret population is thought to be a reason why there is a higher incidence of insulinoma in that area versus the incidence in Europe and UK. The endocrine system is the collection of hormone-producing glands throughout the body. This includes the thyroid, the adrenal glands, the pancreas, the ovaries and the testes, amongst others. Whilst each gland has its own specific purpose, it is thought that the interference in one specific gland may have a detrimental impact on the development of the wider endocrine system. At Marshall Farms in North America, all ferrets are sterilised at 6 weeks of age. This is done to standardise the ferret as a model for scientific research. Unfortunately, the same process is done for those ferrets going to pet homes. Sterilisation at such an early age, when the endocrine system is not yet fully developed, is a controversial point in relation to any future hormonal problems. As such, it is commonly theorised as a contributory factor to the incidence of insulinoma in ferrets. This theory is often supported by a lower apparent incidence of the disease in the European ferret population, where sterilisation does not happen usually until after sexual maturity of the ferret. However, publications do acknowledge that it is only a theory at this time, as it has not been scientifically proven. Low blood glucose affects brain function, with deprivation of the energy source and dullness and confusion. As a result, the common signs of a ferret with insulinoma are lethargy, slight incoordination, staring off into space, disorientation, and weakness of the hind limbs. Evidence of nausea is also commonly seen with ferrets, with symptoms including excess saliva and pawing at the mouth. More serious symptoms are complete collapse, seizures, and comas. These symptoms tend to disappear after providing food or an oral glucose supplementation. However, during a physical examination at a vet, no remarkable abnormalities will usually be found. That is, unless the ferret is currently in a hypoglycemic crisis. Blood tests can be useful in identifying insulinoma. Similarly, abdominal ultrasound can be useful in identifying the presence of tumour nodules. However, this is often not conclusive, as those nodules can be quite small, and therefore exploratory surgery may be required. For an immediate response to a hypoglycemic attack, a mixture of honey and water can be applied direct to the ferret's gums, which delivers glucose direct to the ferret, and it should recover within 30 minutes. Longer term, both medical and surgical treatment exist as options for management of insulinoma. Surgical removal of the insulinoma is often seen as the best approach to outright eliminate the source of the excess insulin production. Most insulinomas are not cancerous, which means it does not usually spread to other parts of the body. In theory, this means that surgeons can remove the tumour and resolve the condition. However, as very small insulinomas may be missed during exploratory surgery, a surgical intervention may not resolve the condition. In ferrets with multiple nodules, a partial removal of the pancreas may be preferable to localised nodulectomy, to allow for the removal of undetected tumours. The goals of medical management of insulinoma is not to cure the condition, but rather to reduce the severity and frequency of the symptoms. But because the clinical signs may progress over time, increased dosages of the drugs may be required. Prednisone and diazoxide are the most commonly used drugs for insulinomas. Recovery from insulinoma surgery is often rapid and uneventful, with post-operative issues such as pancreatic swelling rarely reported. However, for ferrets which have undergone surgery for insulinomas, symptoms unfortunately do frequently recur. This is usually due to the development of new tumours rather than the spread of the original one. If clinical signs recur after surgery, then medical management may be attempted. Surgery for the removal of insulinomas therefore really only buys time, such that the disease can be delayed or can be further depressed by use of drugs. Studies on American insulinomas have identified that ferrets can live from 1 to 3 years after diagnosis on a combination of surgery, medication, and diet. So what do we know? We know that insulinoma is a tumour of the insulin-producing cells of the pancreas. We know that it causes excess insulin, which leads to a shortage of blood glucose, which in turn causes symptoms associated with lack of energy, including seizures and coma. And whilst diet, genetics and sterilisation have been theorised as contributing factors, no cause has yet been scientifically proven. Finally, whilst treatment is not usually curative, you can in many cases still look forward to a good couple of years with your ferret post-diagnosis. Be sure to click on the other videos in this series on adrenal disease and lymphoma, and we'll see you over there in a minute. And for those of you who finished watching the series, thanks for watching. And why not try out some of our other videos on the channel on ferret health and husbandry?